Okay, thank you so much for those of you who are joining along. We have a few more folks coming in. We're up to about 60 folks for today's webinar, Safe is Our New Normal. We'll get started in just a minute or two. All right, it looks like we have a good quorum, a good group. So welcome everybody to Safe is Our New Normal, America's Hospitality Industry Reopens. I'm Leslie Kimball with responsibility.org, and I'd like to introduce John Bodnovich and Brandy Axtell, who can introduce themselves further. And thank you so much for joining us today. Handing it over to you guys.
Thanks, Leslie. We're so excited to be here today with the American Beverage Licensees. I'm Brandy Axtell with responsibility.org. We are also hosting with collaboration with the American Distilled Spirits Alliance, the Beer Institute, the Distilled Spirits Council of the United States, the National Beer Wholesalers Association, the Wine Institute, and the Wine and Spirits Wholesalers of America. I'll be your co-moderator today along with John.
Hi, and I'm John Bodnovich, Executive Director of American Beverage Licensees. ABL is America's beer, wine, and spirits retailers, representing on and off premise or bars, taverns, and also packaged liquor stores throughout the country. We know ABL members make a significant impact on the economy, state, local, national, generating more than 2 million jobs and $123 billion in economic impact every year. It goes without saying, but we'll say it anyway, COVID-19 has decimated America's hospitality industry. Most restaurants and bars have faced unprecedented shutdowns and operating restrictions. After being closed for up to 100 days in some places, laying off employees and suffering devastating financial losses, bar and taverners have taken steps to safely reopen their businesses in compliance with state government guidelines to prevent the spread of COVID-19. This has included a number of different things and a number of different policies that have been put in place for public health. They include policies for rehiring and retraining employees, purchasing personal protective equipment, which we've all come to know as PPE, for staff and other products to deeply clean their businesses, as well as spending money to restock beer, wine, and liquor, as well as food, to serve their customers. Today's webinar, or during today's webinar, we'll explore actions taken to protect citizens and customers, the ABL commitment to safety and strategies for law enforcement, rideshare through Lyft, and health officials to ensure collective responsibility amongst retailers and customers. We know that congressional relief has run out and that the nation is continuing to try and open schools, restaurants, gyms, day spas, elective surgeries, and other businesses, including bars and taverns. Today's webinar will focus on America's bars and taverns, how they're investing in safety, and as states make decisions to open them back up, how they can be responsible, regulated, supervised, and safe places to have a beer, cocktail, or glass of wine. And with that, I'll turn it back over to Brandy to talk a little bit about who's joining us today.
Thanks, John. We have a very distinguished panel today of 5 professionals. Bobby Greenewalt is the president of B&B Beverage Management in Auburn, Alabama. He's also president of the Alabama Beverage Licensees Association and vice president of American Beverage Licensees. Ivy Mix is an American bartender and co-owner of Leyenda in Brooklyn, New York. She also co-founded Speed Rack, an international female bartending competition that's raised more than $1 million for breast cancer charities. And she's also the author of the new book, Spirits of Latin America. Demetrios Jim Mastoris is with the Arlington, Virginia Police Department, where he has served for nearly 25 years. The last 4 years, he's been Master Police Officer and Restaurant and Nightlife Liaison to the Arlington Restaurant Initiative. Ed Hutchison is the Senior Public Partnerships Manager and Law Enforcement Liaison for Lyft, where he oversees traffic safety efforts. And prior to his work at Lyft, he spent 23 years with the National Sheriff's Association. And finally, Nicole Kirkenbush, Chief of Nursing and Performance Officer at Monument Health in Rapid City, South Dakota. Thank you all so much for joining us today. John, do you want to kick off the panel discussion?
Sure, thanks, Brandy. Bobby, I'd like to start with you, and we can just dive right in. Can you tell everyone a little bit about how COVID-19 has changed responsibility when it comes to doing your job and running your business?
Yeah, absolutely. It's taken a severe toll on our company. Personally, our company is down right around 74% from last year. Bars and taverns have had the challenge of proving that they are responsible enough to open their doors, which is a task in itself. We've developed new operating policies, retrained our staff, retrofitted our establishments, and made our cases before local and state governments. We are committed to responsibility during normal times, but in the middle of a pandemic, we must go above and beyond, which has presented additional challenges in itself. We've had to invest a lot of money into our establishments to make them safer for consumers, with little to no revenue to help offset those costs. We closely follow CDC guidelines, including their sometimes weekly changes. When people come to an event or show up to our bar, you can expect to see a sign on the door with all of our safety protocols, including regulatory items, hand sanitizer stations for those to use whenever entering and exiting the property. In Alabama specifically, if guests are eating or drinking alcohol and they are at a safe social distance, they can be standing or seated without a mask on. But for guests not eating or drinking, they must be wearing a mask. We have converted our service stations to allow walk-up orders within a 6-foot space before any other service station, along with plexiglass barriers to help separate them. All of our staff are wearing masks, frequently cleaning, and also operating at a 50% capacity.
And Bobby, would you say that's pretty standard across the board in Alabama? How bar owners and operators have had to adapt, and most people are putting those kind of policies in place?
Yeah, for the most part, most states have a general guideline, and some states may have different specificities that they have to go by. But for the most part, most of those are pretty streamlined across the country.
So it seems like talking to bar owners across the country like yourself, most people are following those guidelines and trying to take, at a minimum, are taking those steps to make sure that their staff and customers are safe. But I think in Alabama, you guys have been particularly proactive with your state government, your governor and state regulators in terms of how you could open back up safely. And I'm wondering if you could tell us a little bit about how you and Alabama Beverage Licensees Association and others have worked with state government on a plan to reopen safely.
Yeah, absolutely. We worked very closely with Governor Ivey's chief of staff and members of her cabinet, including the ABC board administrator and state health officer, to agree to a plan to help open up bars and restaurants safely. We took elements out of the governor's Safer at Home executive order and created the Alabama Bar Promise, which contains rules that are more firm than the governor's executive order. Because of this, the state decided to adopt a new ABC emergency rule that was very close to the rule set in place in Iowa, allowing bars to open back up. As a result of this, any lack of compliance would mean that the establishment would have the potential to have their liquor license suspended, which carries much more weight when dealing with penalties. Currently, the ABC emergency order that is in effect at the moment is in effect through mid-December.
So I think that's fascinating, and I think I just want to make sure that everyone understands what you just said, and I'm understanding correctly. You were willing to face harsher penalties for not cooperating or not operating in by guidelines in order to be able to open up. You were willing, as a bar and licensee community, to say we will take the burden, we'll take the responsibility, we're committed to this, and if you let us do this, we will abide by the consequences if we screw up. Is that fair to say?
Yeah, so we're bound by rules. We are in an industry that is full of rules, from a local government to state, even to the federal government. We have all these liquor rules, laws, and regulations to abide by. So adding more rules to give us the opportunity to continue to keep our doors open and generate revenue, but do so safely, has been something that's been very attractive to us, even though there is a possibility of potentially losing your license. At the same time, if you're in a situation where you are allowing things to happen that could have your license suspended, then maybe it should be that way.
Yeah, it's. I think it speaks to the commitment and to the dedication of the licensees that they're willing to do that, and you know that they acknowledge how much skin they have in this game and how important it is to keep their customers safe and healthy. So you've been through all that. You've put in place the new policies. You've worked with the governor and the other leaders in the state. How has it gone so far? How has reopening gone through this point?
It's gone very well. During quarantine, bars and restaurants could only provide curbside service. When the state started to reopen, bars had to close by 11 p.m., which changed drinking patterns. People came in earlier, drank about the same amount that they would normally drink, and then went home. With the governor's Safer at Home executive order, prior to us having the emergency rule from the ABC board passed, where you could potentially have your license suspended, prior to that, any establishment in violation would be fined $500. But some rogue establishments would just work that into their operating costs. When college students came back from their summer break, we saw some establishments flooded by patrons, and because of this, some local municipalities required all on-premise locations to be closed for short periods of time. Unfortunately, we saw an unintended consequence to bar closures and early closing times, where people began to host house parties. With this, there was zero social distancing, IDs weren't being checked, no one was trained on preventing overconsumption of alcohol, the risk of assault or sexual assault was increased, there were safety risks with no security to stop any altercations, and the list goes on. Unfortunately, when the city of Tuscaloosa bars shut down for a month in early fall, we saw reports and cases of several people who would make the 60-mile journey to Birmingham to drink, which poses impaired driving risk, which is, while it may be a good thought behind making the bars close, it's definitely an unintended consequence. That's when we said, let's talk to the government. Let's go beyond just the local government level and talk to the state government. And we drafted the Alabama Bar Promise and proposed it to the governor to remove the 11 p.m. closing time, but to also institute a 50% capacity restriction, social distancing, and mask requirements, while making her executive order more enforceable with heftier penalties for those in violation. This has allowed us to provide safe drinking environments with strict safety protocols. And we have a 99% compliance rate in Alabama. And now we have a blueprint for how to manage in the winter months and even in the spring as this continues.
Wow, that's, you've touched on a lot of important points there, I think, Bobby, in terms of unintended consequences. The reminder to everyone in the beverage alcohol community, the enforcement and regulatory community, that your businesses are places where enforcement happens. And regulation of those businesses allows for that. You're licensed. You can lose that license. You obviously have an incentive to do the right thing. I congratulate you and the folks in Alabama on the compliance rate so far. And I think your comment on transitioning into the winter and the spring is a great transition to our next webinar panelist today, Ivy Mix. Ivy, how are you?
Hi, I'm well. I'm voting.
You're doing your civic duty. That's great.
I am.
That's fantastic. Well, I would encourage everyone to vote, certainly, either today or in the next week. But so just transitioning a little bit from your voting today, I'm wondering if you can tell us a little bit about your experience in New York. We know bartenders have been on the front lines and have had to adapt to a new normal in terms of service.
Yes.
So if you could share a little bit about your experience in reopening in New York over the last few months and share that with the group.
For sure, yeah. So first off, I just want to say thanks everyone for being part of this call and this chat. I think it's really important, and I can't wait. I know it's being recorded. I'm going to send it along to some other people. I want to echo a little bit about what Bobby said. You know, we're all kind of towing this line between being safe and also keeping our businesses in play, and it's kind of like a game of, I guess, like a game of cards almost. Like, okay, I'll give you this, but we all need to be safe, but we also need to stay in business. So Leyenda, my bar, we're in New York, so we were the first epicenter. We were kind of the first big shutdown, and we I mean, I've been listening to this story about Alabama, and I'm so envious. Our governmental workings in New York have not been as streamlined by any stretch of the imagination. Our mayor and our governor are kind of notoriously not getting along, and in COVID, it was no different. So basically, our governor decided to shut down New York, and we decided as a business the day before. And our experiences were, I think, like so many people, we just thought that we would shut down. We're like, oh, we don't feel comfortable having our kitchen staff who lived in the Bronx, and we are on Brooklyn. We don't feel comfortable having them take the subway this long. And then we ended up shutting down for 2.5 months, with the exception of doing, we did almost like we called it like a CSA for cocktails. You could order your cocktails twice a week and come pick them up, and they were bottled and ready to go. But the interesting thing about right now, I think, is looking at our numbers and looking at what's changed and looking at the governmental issues. So for starters, some really good changes have happened, I think. I mean, you got to take your silver linings in this where you can. To-go cocktails, I think, in a place like New York City, where no one's going to leave New York City in a car and go drive somewhere like Birmingham, like we don't really face those issues from a safety standpoint as much as other places. But the to-go cocktail culture that's happened here has really created an extra source of revenue, while allowing people to enjoy delicious drinks at home, and that's been really good. Additionally, it was decided that we got to create they're called like parkettes or parklets, in the parking spaces in front of people's establishments. People could build outdoor dining, and what's fantastic about that is that that's now been approved to be permanent. But still, I would say that our sales are down. I think we're probably at about, on a good day, 80%, on a bad day, because we're so weather dependent, 20%. I mean, right now I'm outside in the cold and it's freezing, and I'm managing tonight, and I'm already thinking about, like, it's going to be slow because it's cold and people don't want to sit inside. We have 25% capacity at Leyenda, and that's just not enough. So, I know I'm kind of rambling here, but one of the things that I just want to bring up also is that, we're all in the hospitality industry in the end of the day, and hospitality has always been a very important thing for me. I mean, yes, I love the craft of cocktails and what have you, but when we opened up Leyenda, I joked with so many people, with my staff, and I was like, listen, we're not selling bourbon and gin. We're not selling old fashions and martinis here. We are selling some distillates from different places in Latin America that people don't know what they are, let alone can pronounce. So we have to be really kind and compassionate. I designed my bar so it was thin enough that I could reach over and give someone a hug. And now COVID's kind of the antithesis of that, right? It's the antithesis. Someone comes in the door and I point a thermometer at their head in this gun-like fashion and take their temperature. And the tables have turned almost. It's almost like our patrons are being the ones who are hospitable to us and supporting our businesses. But yeah, times have definitely changed, and I'm looking forward to seeing, I hope that we get to join Alabama at 50% capacity inside as the holidays come, but I'm thinking it might be a little unlikely.
Well, you raise a lot of good points, Ivy. Certainly the first part of the hospitality business is being hospitable, and I think it's a testament to people that they're, hopefully you're getting support from your customers, and it's going the other way. They recognize your business is going through a tough time, and they want to support you, just like your food and drinks are there to support them when they're having a bad day.
Yep.
I challenge anyone on this webinar, or participant or panelist, to be able to say, yeah, I can have a 75% pay cut and everything will be fine moving forward. that's probably not the case. And that's what a lot of these businesses, including yours, it sounds like, are dealing with. Um, I wanted to quickly ask you, before we kind of shift gears a little bit, Ivy, what would be helpful? I mean, you mentioned potentially expanding, the capacity restrictions from 25 to 50. That makes a lot of sense. But what are you seeing? Bobby in Alabama, they've been working with the state government. I think you've been involved with some relief efforts when it comes to the federal government, and in
Yeah.
particular the Restaurants Act. Could you share a little bit about what you're seeing and what you've been pushing for?
Yeah, absolutely. So like everybody, like everybody else, my whole life came to a screeching halt in March. I went to Vermont for where I'm from, for what I thought was going to be 2 weeks, and ended up being 2.5 months. And I got involved with the Independent Restaurant Coalition, which was formed because of COVID, um, basically to create a space for independently owned restaurants. And what that means is non-franchised, not publicly traded. People like me, I own one bar, we do less than $1.5 million a year. Like, we're small, right? And unfortunately, the one organization we've had before is like the NRA, which the NRA does great work, but they also represent like big chains. And sometimes those big chains, because they have so much money, they get the priority. So, which makes sense because, put your money where your mouth is. But I was asked to come on because the IRC needed some help, basically represent like, what is a bar, right? What is a restaurant? Because my point was like, yeah, I technically have a bar, but what difference does it make? And then if people are applying for aid and creating aid packages, bars should be involved in that as well, bars and taverns. So we work together, the Independent Restaurant Coalition, with a bunch of other restaurateurs and a few other bar owners, to create what we called the Restaurants Act. And it was put forth in Congress with Representative Earl Blumenauer of Portland, Oregon. And we passed the House, I think 6 weeks ago, which was really great. Now we're trying to pass the Senate. And what's integral to it is that, I've never watched Game of Thrones because it was always on Sunday nights when I was working at the bar, but winter is coming. And with winter coming, I don't care if you live in southern Texas where it's really hot, like it's tough in winter in North America, and people's sales are going to go down. And it doesn't matter how safe we are, like we've switched all of our filters, and we have the UV lights, everything is spick and span and very, very clean. Not everyone wants to come into these establishments still, and that's okay. I'm not going to here to tell anyone that they shouldn't come in, but my business can't continue to run, and I can't employ people at 40% sales. So the Restaurants Act is out there. We're trying to get it. It was originally supposed to be enveloped into Heroes 2.0, but now with the election's almost here. Here I am standing in line trying to vote. So everything's a little crazy now. But I really urge people to call up your senators and ask them to support the Restaurants Act, because literally 90 cents of every dollar that goes into our business goes back out into the economy. So it's really important. And most people in my bar and most people who I know who are in this industry, we're lucky enough to do what we really care about. And we are pillars within our communities, and we need help surviving. So I'm excited to be involved with the Independent Restaurant Coalition, and I'm excited to talk about it a little bit. It's really important.
Yeah, no, I think that's you again, you're raising so many good points. I know that there are a lot of businesses like yours that are members of ABL or that are not, who are 1.5 and under $1 million a year, who are mom and pop, to use an old phrase, but truly Main Street, local businesses that regardless of what the numbers look like on Wall Street, for large corporations, that's not these folks. They're salt of the earth, and they rely on being able to welcome their friends and neighbors into their businesses. So your point is
Exactly.
well taken. And I think I wish you good luck as
Thank
winter
you.
is coming. Right, it's unfortunate that we've had to start using that sort of language, but it certainly gets the point across that urgency is right here upon us.
Indeed.
Randy, do you want to shift gears a little bit? I'll turn it over to you.
Yeah, that sounds like a good plan. I want to go to Officer Mastoris. Now, Officer Mastoris, I'm sure that you would say that law enforcement and regulators have had to adapt repeatedly on the fly this year and really innovate. But Arlington, Virginia has established a really interesting model that's extremely collaborative with the hospitality industry, the law enforcement community, and the business community. And I'm just wondering if the Arlington Restaurant Initiative that you formed 4 years ago has helped you during this time frame with all of the adaptations you've had to make.
Yeah, so here in Arlington, we're just on the other side of Washington, D.C., just across the bridge. We are a very dense, popular community, and we have several nightlife areas. We don't have bars per se under Virginia ABC. The way they're regulated is basically every establishment that has alcohol is a restaurant, but they turn into bars or clubs after 9 o'clock where they have live entertainment, DJs, bands, and such. We were seeing a large amount of disorder with our nightlife areas several years ago, and the creation of the Arlington Restaurant Initiative was a big turning point for us in how many resources we spent. So not just the police department, the fire marshal's office, public health, code enforcement, and we saw this as a real opportunity to work with the restaurants. So it's two pieces. It's establishing trustful relationships with the business owners, and I talk individual relationships. It's not just about going to meetings. It's about having almost daily contact with the people, the stakeholders that we need for success down there. So we use far fewer police officers in our nightlife areas to manage nightlife. There's been an absolute willingness to embrace higher standards and policies. Some of the things that Bobby spoke about, we find that's the case. Most restaurants have a lot of regulations to follow, and it's simply knowing which are important, how do they follow them, and they want to do the right thing. So we empower them to do that. The coalition between us from all the county agencies, we got them out of their silos, and we want people to help within the county. We want them to help the restaurants succeed. So having this in place really put us in a position to, once COVID hit and the restaurants were going through all these hardships, we wanted to make sure that we were providing them with everything we possibly could. Not just in compliance with the law, but how we support them through other stakeholders. And we use economic development here in the county. Arlington Economic Development and the Chamber of Commerce stepped up, and we started putting together resources for the businesses that they can use to get open. We work with Virginia ABC. We work with regulating the executive order from the governor. And we've taken away this punitive approach. Everything that we do is meant to empower, guide, and train. And frankly, very, very few restaurants put themselves in a position where enforcement's necessary.
So I'm wondering, when COVID started and the Arlington restaurants shut down, then when they opened back up again, what were the main issues that you had to deal with the hospitality industry to just make sure that regulations were followed and people were safe?
Sure. So, they after being cooped up for as many months as people were, I think there was a flood to our nightlife areas, and we started seeing things that we hadn't seen in years, especially around disorder and some conflict around the new regulations. When I say and see what restaurant owners are going through, that put us in a position, not just with Virginia ABC, but with our own county government, so that they could understand, so that when they're putting policies and new laws in place, that we are essentially their advocate. There was no way to know how much work the restaurants were doing without us speaking on their behalf. So they were very, very open to embrace, some of the things that we were giving them, such as the de-escalation for dealing with conflict with patrons, some of the to-go, cocktails to go, people were drinking once they had left the establishment after taking them. So, you just roll with it. And the fact that we had all these relationships and inroads made everything easier for us. And we're hoping that as we move forward, right now I have Clarendon, which is essentially our main hub for nightlife. We have new areas within the county, such as Ballston and Crystal City, that are beginning to pop up. And they're experiencing what Clarendon did several years ago. So we have the playbook, we know what to do, we know how to build this trust, and earning the accreditation under the Arlington Restaurant Initiative is the first step, because it provides those standards, policies, and opens their entire staff up to training far beyond responsible alcohol service.
Well, Jim, I mean, just being a resident of Arlington myself, we've been excited to watch this program really grow and the amazing results from it. I can assume that you would be happy to help anybody that would be wanting to set up a similar program in their community.
Absolutely. So we get a lot of calls about this program. Last year, the COPS office, I wrote a toolkit for other agencies and other municipalities to implement a program like ours, essentially the playbook. So we can make that available, and we're also going to make available through responsibility.org some of the resource guides that we've provided to the restaurants to show that, look, we're not just here to enforce the law. We want to make sure that these businesses are successful, because Ivy said it perfectly. They're mom and pop. They're real people with real families. The last thing I want to see are businesses fail in this county.
Absolutely. If people are going to go out and start enjoying time in bars and restaurants, then absolutely they're going to need to start thinking about how to get home safely. Responsibility.org has an app called the Virtual Bar that you can use beforehand, before you go out, to look at how alcohol affects your body. But, Jim, I know you have partnered with Lyft, and I'd like to transition to our next speaker, Ed Hutchison, who is with Lyft. Ed, Lyft has a long history of really working to make the roads safe and save lives. How has Lyft had to adapt in this environment where people might even be afraid to take a Lyft somewhere?
Well, Brandy, first, thank you so much for having me today. The safety of Lyft's drivers and passengers that are in our community is really our top priority. So that's why we are listening to public health officials, doctors, and taking concrete steps in Lyft's health safety program. We all have a responsibility to help protect each other from COVID-19. So in order to ride with Lyft, we've initiated several changes that I'll go into here in just a bit. I'd like to talk about some of our safety programs. Lyft has a history of encouraging other ways to remain safe in our communities or safer. And this includes messaging on such practicalities as like when you're walking or biking, scootering, or entering or exiting a rideshare for individuals to take extra care, to watch for cars and other vehicles, and to stay alert. We're also aware that Lyft had hundreds of thousands of people earning money using our platform last year, and we want them to keep earning those funds. And coming out of COVID-19, having access to gig platform earnings will be even more critical than ever to our Lyft community, especially for smaller towns that don't have great transit or taxi options. Our services have become critical. And I'll outline some of those opportunities that we provided for them here as well. But in response to health safety at the onset of the pandemic, Lyft developed new policies and products and education procedures that we put into place. And these are based on CDC guidance to help everyone practice healthy habits during the ride and to help protect everyone that's actually in the vehicle. At the onset of the pandemic, Lyft worked with government officials to determine rideshare as an essential service This is really critical in being able to get those drivers back on the road and provide those services that are really lacking in those communities during that time. While public transportation shut down, Lyft went to work, and we partnered with 500 organizations. We added food delivery, homebound senior deliveries, bikes for critical healthcare workers. An example of this is Lyft's work with the National School Board Association, and we use this to provide transportation for families to access food banks and school lunches. Some of the other programs that Lyft provides at this critical juncture in this new, I would say the 2020 paradigm, is our Jobs Access 2.0. A lot of jobs have been lost in this economy and in this pandemic. So Lyft created a directory for individuals to participate both in need and looking for jobs, and for those giving back, like volunteers working to get people into those jobs. Lyft manages the programs with core national ride partners such as Goodwill and United Way Worldwide. One of our other programs is our Grocery Access 2.0. Lyft is responding to the immense ongoing need for delivery transportation services and food delivery partnerships with a focus on low income and seniors with select partners to set that process up locally. For our healthcare access program, Lyft has assisted during COVID-19 and the lack of transportation to really fill that essential service gap as the opportunity to improve access to healthcare, particularly for low income or elderly users. But also with select partners, Lyft helps patients get to rides to non-emergency medical appointments. These are for like issues like cancer treatments and dialysis. Now, I told you that I'd review how Lyft is making those rides safer, because without that trust with the public, people simply wouldn't get into those vehicles. So for now, Lyft has paused all of our shared rides. So when you call for a Lyft, you can rest easy knowing that it's only for you and for the people that you're traveling with. All rides and drivers, the riders and drivers, they have to agree to new rules before they can actually use the Lyft. Those requirements include health safety commitments. Lyft also requires face coverings for riders and drivers for the entire ride, and individuals can cancel that ride, either a driver or a passenger, if they are not wearing that mask. And then drivers have special cleaning instructions for their vehicles, and riders should sanitize their hands before touching anything in the car, sit in the back seat, and do not ask to use the car charger, for example. Windows stay open when possible to recirculate the air, and some of our Lyft drivers have received passenger shields, or they're installing their own. And for me personally, this is a personal issue, one that I've dedicated a lifetime of work to, and that's one of our #1 priorities, and that's for working with Lyft and curbing impaired driving incidents on our roadways. And studies really correlate rideshare with inroads in this area. Anecdotally, law enforcement, state highway safety offices, and other experts, we've heard from many of them, are discussing how during the pandemic, there's been an increase in impaired driving and in speeding on our roadways. I think that was alluded to in some of our earlier discussions. Alcohol and drug impaired driving account for approximately 30% of all motor vehicle fatalities each year, and that's not something that any of us are unaware of. Lyft and Rideshare offer potentially impaired drivers with access to alternative transportation, and Lyft has positioned itself as an accessible alternative to driving impaired, especially during the days, the times and the locations that it's most needed. That's really just how our platform works. I'd like to give you some of the highlights that we found when we started overlaying some data of rideshare when it actually enters into a community. And as that number of riders increase, we have found that overlaying that on FARs and DUI data had some really impressive results. So from 2014 to 2017, Chicago saw a 40% decrease in DUI incidents, while Lyft rides increased in the same period. In that same time frame, Atlanta saw a 41% decrease in DUI incidents, while those rides increased. From 2013 to 2017, San Francisco saw a 31% decrease in DUI incidents while those rides increased. 2015 to 2018, Madison, in another example, saw a 20% decrease in DUI incidents while Lyft rides increased in that same period. And this is one of our competitors, but a CUNY research report found that in New York City, an estimated 30% decrease in DUI collisions after the introduction of rideshare. So anytime anybody plans to consume alcohol, a priority is also planning for that safe way home. Independent studies on rideshare impact or impaired driving and reports are favorable to a correlation between Lyft and reducing those DUI incidents. I'm very pleased to present that. And then the bottom line is we all want safer communities, and I think that's something that we can all agree on. And then finally, I would just point out that in the realm of safety, Lyft has distributed over 160,000 sanitizing products free and face coverings at no cost to the drivers. And we created an online store where drivers can access face masks, hand sanitizers, and more cleaning materials. There's no Lyft markup on any of those items, and this is available for all of our drivers at no profit on those sales. So that's a brief overview of some of the safety measures that we've provided for a safer community and a post-pandemic future, hopefully, Brandy. And I just appreciate your having me here today, and I want to thank you for that opportunity.
No, thank you, Ed. And I think those points are so important. Responsibility.org is working to eliminate impaired driving, and rideshare, I think, is a really important part of that, especially as we moved into the winter months and people are getting back out a little bit. I myself took a Lyft this last week. It had the plexiglass shield. I felt very safe. But I think this is a good transition to our last speaker, and that's really a focus on what the consumer needs to do, because we can all work hard to make the places that you go safe, but what does the consumer need to do? It's a safety partnership. Nicole, you've been in this field for a really long time. You've been taking care of people all year. Thank you for all that you do. Can you share some advice to the people on the webinar today on how you should adjust your expectations as you get back out in this interim period?
Yeah, thank you, Brandy. And it's kind of interesting to be on a webinar with people I've never met from Lyft, Edward and Ivy from the hospitality industry in New York. And thank you to those two folks for the things they're doing for the health of our nation too. I think Lyft has been a great partner for us during this. Our patients often do need transport that they can't get. And I appreciate, Ivy, your dedication to breast cancer research, and just thank you. This will probably sound like a broken record though, because everyone is hearing this all the time. Stay home if you're sick, number one. I'm actually working from home today because I have a little sniffle, and it's not something that we want to introduce into our healthcare settings. So we definitely have adjusted our lives with things like Zoom and WebExes and other ways to connect with our workplace, but stay home if you don't feel well. Stay home and don't go to the restaurant or the bar if you don't feel well. I would also say if you're at the high-risk populations, same thing. Please be cautious about where you are going, what you're doing. I think it's great that there are services like curbside pickup, to go, delivery for those populations, because it is still important to be able to do things that are important for your social activities. But those in the high-risk populations need to really be careful. If you are going to go out, I think wearing a mask. That's been up and down through this pandemic. Do we wear them? Do we not wear them? We're really at this point where if you're going to be out and about, you need to wear a mask. Just today, I think actually maybe 20 minutes ago or so, there is a webinar being held on the east side of our state over in the Sioux Falls region. We are partnering, Monument Health is partnering with the other two healthcare systems in our state, as well as the South Dakota Board of Medicine, the South Dakota Nursing Association, other groups to launch a Mask Up South Dakota campaign. I know that is a very private, very personal decision about masking, but we, from a healthcare perspective, are wanting to ask people to follow the CDC guidelines. If you're out and about, be safe for yourself, be safe for your neighbors, our community members, and wear that mask. I think too, washing your hands, that's something that I've preached my entire life. I think, you know, my kids get sick of me telling them, wash your hands if you wash your hands. But, you know, now everybody is thinking about it. I will tell you, I still, even through this pandemic, have gone out into a public space, used the restroom, and watched people leave without washing their hands. Drives me crazy. Like, this is so basic, and it takes no resources other than water and some soap, basic things that can be provided in all of our public spaces. So please do that. Hand sanitizer is a good substitute, but just a reminder, don't just rely on the sanitizer. Go in and wash those hands every so often as well. There are some other things here too about, you know, if you're going into the restaurants, the bars, being very cautious about distance, social distancing. And it sounds like the partners that are on this webinar today have done a great job in setting up their establishments so that they can safely serve their patrons. And I think it's important that you know, just think about what's your social surroundings like? Are you distanced from people that you don't know enough? Don't share, you know, the water glass, the forks, those kinds of things. Pretty basic, honestly, that we shouldn't probably have been doing even before this pandemic. We're hitting flu season now. I ask that everybody get their flu shot. Definitely, flu vaccine this year is going to be super important. There's some people calling this the twindemic timeframe, where if you have both COVID and influenza, what's that going to look like? We're still, you know, kind of working through what that might mean for our patient population. And then maybe one last thing that I would say, following on Edward's comments from, you know, a safe perspective, please, we are seeing a high increase in our traumas here in our part of the state. And I talked to other chief nursing officers throughout the country, they're seeing the same thing. If you're going to go out and take a risk, because there's not a lot of ways to do that right now. Our communities have not been able to do their normal activities. People didn't get vacations this summer. People are dealing with the stressors of kids being homeschooled or distance learning, all the different things that this pandemic brings. We are definitely seeing people take risks that maybe they wouldn't have in the past. Drinking and driving seems to be up on the increase in our area. I would encourage people, please think about that safe getting home. Do you call the Lyft? Do you have a designated driver? What do you do? We're in a place where there's lots of outdoor activities. Lots of ATV accidents, people who've decided this is a great time for home improvement. They've never used a circular saw before, and they don't know the safe way of doing that. I would just ask people to think about what are they doing in their lives to, you know, sort of deal with this pandemic, and please do that safely. I absolutely think that we need to make sure that we are able to have the restaurants and bars open in this country. The social effects of this pandemic are just as difficult to deal with as the medical effects. And so, you know, just understand it's going to be different. Everything is different at this point. As much as I would like to go to sleep tonight, wake up tomorrow, and find out that this was all just a bad nightmare, that is not going to happen. And so I think people need to recognize what is going to be different. How do I adjust my expectations? I would ask people to find grace and patience. As we heard from Jim, there definitely is an increase in just anger out there. We see it in healthcare too. But give everybody a break. Give yourself a break. And the three key things: mask, wash your hands, and social distance. You know, if you do those three things, you're going to be okay.
That's such good advice. Thank you, Nicole. John, do you have any questions for Nicole?
I just quickly, I mean, I that all makes sense, Nicole. I think, you know, appreciate all you're doing in your role as we as a country are working through all this. You touched on it just briefly. I'm wondering if you could just expand or just kind of reiterate and emphasize, you know, for places that have reopened or opened, where people are venturing back out into bars and restaurants. You know, everyone on this call today is kind of on one side of the table, right? They're the server, they're the owner, they're helping with, you know, make sure that everyone's safe, whether that's through transportation or just in general, you know, from the police perspective. But what would you say to folks who are venturing out to the you know, the consumer side, the customer side,
Mhm.
because our folks can be as responsible as possible, but it kind of takes two to tango. So what would you say to those who are customers who are going out there and want to go have a little normal in their life and have a margarita or have something to eat at their local restaurant? What would your message be to them?
Yeah, I think my message would be, if you don't feel well to start with, don't go. That's kind of rule number one. And I know that can be hard when people want a sense of normalcy, but if you're not feeling well, stay home, get over that before you go out. Number two, if you're gonna go out, great. I don't have any issues with that. Please wear your mask. Please make sure that you're washing your hands and you sanitize before going into the establishment. And then please follow the rules that have been put forth. That's really hard for these businesses to moderate. I've seen even areas in our own community here where small businesses have had to hire a security guard in order to make sure that their own workers can be safe when they try to enforce people wearing a mask if they don't want to. That's ridiculous. We need to have some adult personal responsibility. If you're going to go, follow the rules that are put forth by the establishment. And it might be different. It might mean you don't get to go and have a 3-hour get together with your friends at the bar. But it doesn't mean that you can't go, have a drink, follow the rules, get home safely, and see how this progresses. And so I would just ask those patrons to still know what the rules are. In most places, it's going to be social distancing and masking, and then wash your hands and use the sanitizing stations. And be kind to those folks that are trying to do their job and trying to offer us a little sense of normalcy.
I think we can all agree with that.
Can I add to that?
Times.
Can I add to that point?
Sure, go ahead, Jim.
Yeah, I couldn't say it any better. Give these people a break. The fact that they're open, the fact that they're taking the risk that they are just to stay open and their families is a big deal. So, we saw some conflict with turnover at tables. Restaurants were doing every 90 minutes, and they felt that they didn't have to leave. So it might be the difference between your favorite restaurant staying open or being closed. And you're putting them also in a position where they may be violating the executive order for the restrictions of their state. And it's really of no fault of their own. They've had to really take huge precautions just to keep the rules, from not being followed by patrons who just want to do what they want to do. They want to get back to normal, but again, it just might be the difference between them staying open and being closed. So being kind is about as good thing as you can say these days.
That's so true. And, I think it's really a good example. Today's discussion has been of it's really a safety partnership at many different levels, and everybody has to do their part. So thank you all, especially Nicole and Jim, who have worked so hard all year to save people's lives and keep people safe. Thanks for being on today. Does Leslie, do you want to move it to the question and answer period?
Sure. For those tuning in, you can submit a question. We don't have that much more time left, but you're welcome to submit a question. There is one from Jocelyn Kane. I think it's for Bobby, but how long can you stay open under I think it's the Alabama promise, and is there still a curfew?
Sure. So with the Alabama promise, we got the new ABC emergency rule passed. With that, there is no curfew and there is no restriction on how late you can stay open, with the exception of whatever your local municipality will allow, along with on Sundays, all bars in the state have to close at 2 a.m. But that there is no restriction.
Okay, got it. And I can also see, Bobby, that you answered another question to the panelists about sort of whether or not did the students being open and not being able to go to bars, did that drive house parties? Do you want to address that too?
Yeah, sure. So the question asked about most drinkers being under the age of 21, and that is true. About 70% of students in a college town are under the age of 21, but local police are stepping in to help with those natural house parties that would happen for those people that are underage. They're stepping in with additional ordinances that would help mitigate those instances. We can't prevent house parties from happening, but by having a drinking establishment that is open safely and following those strict guidelines, it's going to be much safer than having a larger amount of house parties going on that are unregulated.
Awesome. Okay, thanks, Bobby. All right, we do have one question from Denise. With the increase of cocktails to go options, are the bars making enough efforts to encourage their patrons not to drink and drive and to wear their seatbelts? Making good decisions saves lives.
I can answer a little bit to that. I know I'm in New York, where, like I said, not that many people are driving, but the thing that's really important for us here and what we had to tell everyone is, like, yes, we can now sell you cocktails to go, but open container laws are still a thing. You're not allowed to take this drink and walk outside and crack it and walk around. And even less so are you able to get on your scooter or your bike or your car. So most people I know, in the conversations I've had with bar owners across the country, there's a real conversation with people about the rules and responsibilities of having a to-go cocktail, that just because you took it out of an establishment which has the liquor license to serve you said alcohol does not mean that that's an okay thing to drink anywhere else that was not okay to drink before. And that's the general rule of thumb. It's just a matter of, I really suggest that people ask, if you aren't told how to drink your to-go cocktail at your establishment, that means that no one else is being told either. And you should ask your establishment, like, hey, I like your drinks, I like who you are, but I bet you people are abusing this. So it's important to ask.
And I would just add to that my experience has been an increase in the number of both state highway safety offices, private partnerships with different organizations that deal with the entertainment industry, reaching out to me to really build out the kind of coalitions in their communities to address exactly that. How do you get those individuals safely home?
Okay, got it. And thank you. And one last one. We have time for one last one. In what ways can establishments promote ride sharing to their patrons at the establishment?
So that would really drive down to the local level. It would depend if it's a private industry, like a bar or a restaurant, or a community of bar and restaurants, which is, I guess, what Chief Officer Mastoris's foundation is based on, is really building out that coalition. How do you address impaired driving in a community that you're going to reach that demographic that you're trying to reach? That's been a really important part of the conversation, that 18 to 35 is really kind of drawn to rideshare. So it's had some really great results in that capacity. But really just having that conversation, starting with your community. How do you want to address that? To what scope and scale you want to address that? And who are those key partners? Is it your sports industry, entertainment venues? Is it your restaurants or bars? What is it in your community that you want to achieve? What's the demographic? What's your timeline? And who are those strategic partners? I think that's all important questions that begins that conversation.
Great. Thank you, Ed. All right. Thank you so much. John, do you want to wrap us all up?
Yeah, thanks, Leslie, and thanks for those questions. I want to thank all of today's panelists for taking part in this webinar and sharing their expertise and experience with all of us. You've all just been tremendous, and it's important that to hear from these individual perspectives from different areas of our hospitality ecosystem when we're talking about this. There's little doubt that enjoying a drink responsibly at your favorite bar or tavern is certainly more complex than it has been in the past. But I think today's shown us that retailers, industry members, rideshare companies, those who enforce the laws, and a whole bunch of other people are prepared to rise to the challenge so that we can continue to have a vibrant hospitality industry in our country as we get through all this. I want to just remind everyone you can find more information about what it means to be a responsible retailer and customer at ablusa.org and responsibility.org. And I'd also want to remind everyone, please be on the lookout for future webinars and information as we all continue to navigate what it means to retail alcohol responsibly in the age of COVID-19. So thanks everyone for joining us today, and Brandy and responsibility.org and all of our panelists. Thanks again. Everyone get out there and vote, and have a great afternoon.
Bye-bye.